So
No.
welcome everyone. I'm interviewing today my friend Dr. Christine Schaffner. She's in the Seattle, Washington area, but she actually has 3 clinics. One, are you still in all these? One in California, one
Yeah,
in Woodinville, Washington, one in
Seattle.
Seattle.
Yeah, so we have a lot of patients who come from all over the country, and a big goal for me is to, like you, Bridget, just make more of this medicine more accessible to more people. So yeah, we're just taking a stab at training more doctors and supporting more patients in more communities.
Awesome. Way to go. Yeah, people really like to actually go to a physical place sometimes too. So,
Mhm.
it gives you that feeling of being supported and all that. So that's awesome. So you're a naturopathic physician,
Mhm.
and your specialty, in my words, is kind of complex, multiple conditions, infections, toxicity. Can you explain for people just getting to know you is more about what you specialize in?
Yeah, absolutely. So I feel like I specialize in complex chronic illness, and obviously there's a bigger conversation, which I'm so happy about all of these topics. There's a lot more awareness about Lyme and mold, and the typical patient has a lot of neurological symptoms, but they've just generally been unwell for far too long. So they can have everything from brain fog, insomnia, anxiety, depression, all sorts of neurological symptoms, and then also body pain or a lot of digestive symptoms. And, they've tried a lot of things, seen a lot of doctors, and, typically traditional labs and diagnostics don't always lead in the right diagnosis or direction. So they kind of fall in this, gap of not being able to be properly treated for, again, too long. And again, I'm so happy people like you in our community that we're trying to spread the word so people can get diagnosed more quickly and on the right treatment. So yeah, I see patients like that, and then we have a framework. I work with Dr. Klinghardt in Seattle. With also, we have a wonderful team with medical doctors, chiropractors, naturopathic doctors, and we all, have this whole framework where we look at any really chronic condition as an imbalance in the immune system, and typically we look at stealth pathogens like Lyme and co-infections, virus and retroviral infections, mold toxicity, as well as fungal infections. Parasitic infections are very common and undertreated. And then we look at that in the backdrop of environmental toxicity. I think that's a huge piece, and I know you do so much work around this, Bridget, of educating people about our lifestyle and our environmental exposures, because things like heavy metals and pesticides and persistent organic pollutants bioaccumulate in our body, and they weaken our immune system and also kind of overwhelm our body's detoxification pathways, so we can't handle all of these other things that we're up against. And so we look at that, and then we are big believers in epigenetics. So there's a ton of information about genetics these days, which is great, but it's all about how does our environment, including, not, when we talk about epigenetics, it's not only our environment, but also this whole an emotional landscape that we all have, from our emotional and mental well-being to, depending on your belief system, ancestral trauma to spiritual, issues that can affect our epigenetic expression of certain genes. And so yeah, we have our, we could spend, I always laugh, I could spend one day, a full day with one patient with everything that we cover and we have to do, but we have a wonderful team where we all, carry part of that, of that heavy lifting for the patient. And I think the patients who are really struggling with complex chronic illness really need a team. I kind of see myself as a quarterback, like I'm just the connector, kind of helping with the roadmap. And then, there's so many wonderful practitioners we work with, not only within our team, but with referrals that really, they specialize in an aspect, whether it's like a physical modality or IV therapy or emotional work. And this kind of comprehensive nature is what I've seen people get better with.
Yeah, I totally agree. It's so multifactorial. And like you did this summit, we were chatting about the energy body and different techniques around there. And some people might be like, oh, that's so far out. But like, you really, like, you can't just work on one level. We talked about that last time I interviewed you. And I love the sharing thing. We were just talking how we had a shared client. Like, none of us know everything.
Mhm.
Um, and being a patient with chronic, complicated diseases, and now being a practitioner, I I don't want to be a one-stop shop for
Mhm.
everybody because it's limiting for them.
Mhm.
And and on the patient side, you can get a little too excited that someone's going to be like the one or like have all the, be your savior. And that's dangerous because you can be disappointed, and ultimately you need to be in charge of your own health journey. And
Yeah.
if you go to someone and you're just not clicking with them, or,
Mhm.
I just had a client today and she was getting some recommendations. She felt like we're too aggressive for her body. And I was like, yeah, it's your decision.
Mhm. I'm such a big believer in that. I feel like, it's a collaboration, right? And I feel like I help patients the most who are really, in tune and in touch and help guide me to guide them. And that's a really fun way to work. But yeah, it's just, I love working with a team. I could never do this work alone, or do I ever want to. It's just so much more fun because we all have a piece to the puzzle, and we all have our blind spots, and we all have a lens that we see these things. But yeah, it's a work in progress. I mean, I think this field is evolving so much, and the exciting
Yeah,
thing for me is like we're learning, right? Every year there's more information and more people talking about this, which is awesome.
it really is changing quickly. So something that I've interviewed you about that I think is a real specialty for you is the lymphatic system. In fact, I think I might have first heard about it from you. And
Mhm.
I was like, whoa. And I believe the product that we're going to talk about soon ties into that. So could you just talk a little bit importance of lymph, what is it? What is the lymphatic system? Just kind of get us primed here.
Yeah, absolutely. It's one of my favorite topics, and I think it's one of the most overlooked topics when people come to see us. And so, for those of you who are new to the lymphatic system is a body wide system where I think of it as a waste clearance and a immune surveillance system. So, it's a way that our body
Mm.
cleanses and gets rid of toxicity, but it's also an area where our immune systems recognize and fight infections. So, you can just think from the image of if you have a swollen lymph node, you could have a viral infection or a bacterial infection where your immune system's working hard to create inflammation to clear that infection. So that's happening in the lymph system. And in conventional medicine, we only really think of the extreme lymphatic issues. So you might have heard of like lymphedema if someone's had a surgery or something that where they remove lymph nodes, and then there's just pooling of the lymph, and they need all of this specialty work. And yes, that's one extreme, but this is a system that's so important in complex chronic illness because the lymph system is intimately tied into our circulatory system. And so a lot of our patients have poor circulation and microcirculation because of all the things I'm sure Bridgit talks about, even with how mold and chronic infections affect the body. And our
Well,
blood.
actually, I would love for you to explain the why on that a little
Yeah,
more
yeah,
because
just
I don't think I have enough.
oh yeah, no problem. So, when we think about, we can keep like things that are really complex, but then we can really make them simple, right? In a lot of ways, right? So, a big part of our health is carrying oxygen to our tissues, and also carrying nutrition to our tissues and removing waste. And our circulatory system has two parts: our arterial and our venous system. So, we have a way that we bring blood flow to organ systems and tissues, and then remove that blood. But what happens is as blood flows to these organ systems and returns basically via the veins, it goes a big portion of the blood gets filtered and gets basically exchanged through the lymphatic system. And so when we think about the lymphatic system, why I brought the circulatory system up is because having good blood flow actually helps us to have good lymph drainage. And so
Mm.
our circulatory system has its own pumping action, and there's lots of interesting ideas around that these days. But our lymphatic system actually relies on the circulatory system and also the movement in our body. It doesn't have its own natural pump, as far as we know from now. So when we have compromised circulation, so a lot of our patients will say they have cold hands and feet, or they just they just feel tired all the time, or they have anemia, or these things. And what chronic infections can do is they can do a number of things, but just to keep this high level, when you have chronic infections, you can have what we call thick blood or hypercoagulable blood. So there are lots of mechanisms why we could have either what happens is the red blood cells clump and create what we call rouleau. So that's a clumping basically in the bloodstream that doesn't deliver oxygen as well. We also have an increase in fibrin that happens with
Mm,
biofilm formation and all of that.
mm,
And that will also make the blood thicker. And so when you have thick blood, when you have to get the blood to kind of the extremities and the small to reach places, we don't perfuse our microcirculation as well. And so Dr. Shoemaker, who is one of the pioneers in kind of understanding what mold does to the body, he talks a lot about these adaptations that happen where we have poor blood perfusion and poor microcirculation. So we really get hit, our circulation gets really hit from Lyme, co-infections plus mold and toxicity. Toxicity can do this as well. So so yeah, blood flow is really important. And not to take us down a rabbit hole, Bridget, but I'm we're friends with Dr. Pollock in Seattle, and he really pioneered this application of the fourth phase of water to our
mm.
human biology. And what he, really feels is that, we need this exclusion zone water in our body basically to propel red blood cell exchange in the capillaries. And so there's just a lot of people looking at this from a different angle. We think we know,
Mm.
so much we know about the body, but I think it's exciting. There's stuff that gets discovered all the time. Like the lymphatic system was only discovered in like 2015. So, I think it's really
Wow.
important for us to stay true to science and what has been documented, but also to keep our minds open, because I think there's also still things to be discovered. And, but I digress. But, but anyway.
No, that's interesting. Little side note for sure.
No, right? Oh my gosh. But, bringing this all back to the lymphatic system. So, the lymphatic system, again, is this waste clearance immune surveillance system. We have lymph glands. We have, our tonsils, our thymus, our spleen, our appendix. That's all within the lymphatic, glandular system. And then what we have as well is, this body-wide network. And that actually, I do feel like we're going to be learning more about that. I think we know, but we're still in discovery, because what happens, there's a lot that happens when someone's alive that's not being studied. And when they look at cadavers, they don't get the full picture. And that's what happens
Mm.
with the lymphatic system. So we have this body-wide lymphatic system. And then we have what they discovered in, I think, 2015, is that the brain actually has its own lymphatic system. It's called the glymphatic system, the glial dependent lymphatic system. And what happens is, it's why sleep is so important, because this system is really only most active when we sleep. And so our brain shrinks 60% in size to make room for lymph to basically,
Crazy.
I know it's crazy, flow, bathe neurons, remove waste, and then it flows out of the brain along the veins. And so, so I actually, when I learned about this, I'm like, that's it. We just have to support people's brain's ability to detoxify, to really recover our nervous system and our all these neurological symptoms. And so, a big part of our work is devoted to that. And I can share more, of course, but yeah, it's one of the most overlooked systems and one of the most rewarding systems to treat, because people start really feeling better when we get their lymph moving.
Awesome. Yeah, and when I was my sickest,
Hmm.
I got really into dry brushing, which
Hmm.
I had known about, but it was like, it's like I should do it, but I don't really do it. And then when I started doing it when I was sick, it was like, wow, it really felt so good and energizing. So we're still big proponents of dry brushing. I got lymphatic massage when I was sick. And now when I'm just out and about, I just see it everywhere. I see the puffiness that so many people have, even if people don't know they have chronic illness, but they're just, their blood sugar is off. They're not circulating. I'm sure they have sticky blood, that things are just off and they're just puffy, and like it makes me sad to see, because I think it's something that can be, worked into the program. It's just moving lymph. It's, in a way, it's a kind of simple, you
Yeah.
know, there's some great tricks you've learned along the way, but
Mhm.
it's such a simple concept that very few people are participating in.
Mhm. Mhm.
Yeah.
Absolutely. And when you think too, I love talking about the extracellular matrix. So it's kind of the space in between the cells. And so our health is, the combination of how vital our cellular health is, right? And so the better and more efficient our cells can make energy and all of the things we need for life, the better. Um, we will feel. And so the lymphatic system is basically the extracellular matrix rather drains into the lymphatic system. So if there's lymph pooling or congestion, that can build up toxicity in the space. And then cells have impaired cellular communication and impaired ability to get nutrients in, toxins out. And so it's really how you said you felt better when you had the lymphatic drainage. It's multifactorial why people feel better, but it's such a I feel like foundational piece, especially you said also like patients were feeling like they're not ready for treatment, or that might be too aggressive, or there can be
True.
in this world there can be the world of Herxheimer reactions and die-off, and we really try to minimize that. I really want to change the language that people have to feel worse before they get better, because I
I'm
really,
with you.
I don't think
Not
that's
true.
the case. So, but getting the lymph moving and having really focused lymphatic support, especially going through harder protocols or stronger protocols or any antimicrobial, anti-infective protocol, really, really minimizes side effects.
Awesome. Yeah, and we're going to talk about the products you developed in a sec. One thing I want to ask about, because I've still never fully implemented this, was like your bed and how you sleep. That's very interesting. I think people will tell
Yeah.
us like how to promote this
Yeah.
brain drainage overnight.
So again, sleep is so important, not only because you feel better, but it's because your brain needs it to remain healthy, right? So we have all these things we talk about with sleep hygiene that I'm sure Bridgit has educated you on. And one of the things that, especially if you're suffering from a lot of neurological symptoms, is that you can actually create an inclined frame in your for your mattress, and so you're sleeping at a 5-degree angle. And I've had patients do this and they feel so much better. And so I do see, I mean, again, everything's individual. So what works for one person doesn't work for another. But I feel like if you can have like a 5-degree angle, so they're different bed frames. We work with a company, Samina. They're more high end, so not everyone can afford them, but they have like really, really high quality materials and bed frames. And they really educated me about the importance of inclined sleeping. So there's that, but you can also put prop up your mattress underneath the head of your mattress at this 5-degree angle to create this kind of incline sleeping degrees.
Like put in like cardboard or something
Yeah,
under your
a
mattress.
book. Yeah, I've had patients do books even underneath the bed.
Well,
Just
that's easy. I'll
yeah.
go do that.
So,
Actually,
yeah.
we just got delivered a phone book recently.
Yeah.
I'm like, it's not that big, but I'm like, really? Really?
Yeah.
Are you still giving these out?
Wow. Wow.
So if it has out of the recycling, maybe it should go under my mattress. Interesting. Okay, so now let's talk about your product. I put the link in the chat.
Yeah.
I'll go look on the page so I can look at it.
Yes.
But yeah, tell us about it.
So we're always looking for solutions, right? And we were able, with the help of our friend, Dr. Marco Ruggiero, develop a cream. So Dr. Klinghardt and Dr. Ruggiero, and kind of all the work that we're doing at Sophia, we really understand the importance of good lymphatic drainage and also clearing the lymphatic system in the brain. And so when you think about how to optimize lymph drainage in the body, we really focus a lot on the neck, because the neck, if we have any congestion in the cervical lymph nodes or in blood flow in and out of the brain, that's going to actually not allow the lymph to kind of flow out of the brain as well. And then we get congestion, and then we get stagnation, and all of that leads to poor cellular communication and even neuronal cell death and symptoms and all of that. And so one of the ways to help is to really just open up the lymph channel. And so we are working with this cream, and this cream is pretty unique in that it has a proprietary probiotic blend that this is a lot of Dr. Ruggiero's life's work. He is a radiologist, and he actually was one of the, he studied things like HIV and, early in his career, and he's really, and he's done a lot of work with cancer, and he's just a very, multifaceted doctor. And so and he's very innovative. And so he created, or he found that this special probiotic produced a peptide. Peptides are different amino acid sequences called GCMAF, or macrophage activating factors. So this peptide actually supports our immune system's ability to fight infection, right? So a lot of why we have congestion in our lymph area, especially in the neck, could be secondary to chronic viral infections or Lyme and co-infections. So we're supporting the immune system through a transdermal application. And then there's things like vitamin D3, oleic acid, chondroitin sulfate that also have an immune enhancing effect. And so the formula looks simple, but it's doing more than what you probably realize, knowing that there's this peptide that gets produced by the bacteria. And one of the things too is, we all know that when we put something on our skin, I mean, we use topical medicines all the time, but I think our understanding of how these things actually get into our skin is enhanced because of, they've coined the term just recently, interstitium, right? So going back to this idea of we're discovering new things in our body all the time. And the interstitium is this layer under the dermis or under the skin that is fluid filled. And it's kind of where the kind of the fascia and the interstitium all interconnect. And then that goes into the lymph system. So what I'm using and why I'm saying that is that the interstitium is like a delivery system into the body. And so if we can put things onto the skin, it gets absorbed in the interstitium, and the interstitium can carry things throughout the body and go deeper. And so, so we know we can get an immune effect and a lymph drainage effect using a topical application of this cream. So it's been really fun. We've been working for a number of years now, and we have people put it on their neck 1 to 2 times a day before bed. I sometimes have people put it over their spleen or their liver or their spleen, or if they're having body pain, sometimes it can be helpful. The cool thing when we were going through the development of this product, Dr. Ruggiero came to Sophia and he did before and after ultrasounds on, I think I'm going to cough. I'm going to just have a sip. He did before and after ultrasounds after the application of the cream and showed enhanced blood flow. So we know it works. So it's exciting.
Oh, cool. Yeah, I was excited as I read this that you have the phosphatidylcholine in here. I love phosphatidylcholine, but I'd be curious more, how you're using it for lymph, maybe just like you said, better communication. The phosphatidylinositol, I've heard of this phosphatidyl, what is this? Ethanolamine? I don't know much about.
Yeah. It's just a combination. So phosphatidylcholine is one phospholipid, and these are a combination of phospholipids that are naturally occurring in our body. And whenever we combine anything with phosphatidylcholine or other phospholipids, it enhances the absorption. So it's
Okay.
Yeah, so it's going to be a delivery system.
Gotcha.
Plus, it's a building block. So I like using phospholipids orally as well, or liposomal products, because not only enhanced delivery, but again, like you were saying, phospholipids are what our cell membranes are made up, our brain and our nervous system. And as we when we're dealing with toxicity or chronic infections, our cell membranes can become damaged and need to be replaced and replenished and repaired. So giving good essential fat sources is a really great treatment.
Okay, cool. So, we've talked about lymph and why it's important to move, but people may be wondering, well, is this a fit for me? So I'm wondering if you can say, these are the types of people, types of cases that could benefit from it.
Yeah, this is one tool. This has become a staple, for us, Bridget, and most of our protocols. So most of our patients, and we use ART in practice, so that's autonomic response testing. So it's a form of biofeedback or muscle testing that helps us to, just be more targeted to what our patients need. And so with ART, we usually, get favorite products that test for like the majority of people with ART, and this is one of them. Again, what works for someone is not going to work for another person. So you have to, of course, be individually minded. But this, this works really well for most people. And, I would say, the people who, any of our patients can really benefit because all of them have stagnated lymph and all of them need support with, brain drainage. One thing maybe I haven't mentioned is, with thyroiditis and Hashimoto's and all
Oh, yeah.
the autoimmune things that are going on with the thyroid, I do think applying the cream to the thyroid gland is like another strategy to treat, thyroiditis. And so that we have all these internal things that, of course, please do, but the topical application can just bring good lymph drainage to the gland. And, this is such a vascular gland that's kind of in the middle of this really big traffic zone, and then it's very vulnerable to toxicity in the body. And so, yeah, the flow cream is just a really good tool for that as well.
Okay, so to break it down into kind of symptoms and conditions, it sounds like brain fog, thyroid conditions.
Yeah.
Go ahead.
Yeah, even like sinus condition.
Oh, good. Yeah.
You get a lot of lymph stagnation in your head when you have a chronic sinus issue. So that can be, helpful. Whenever we're dealing with anything dental,
Good.
open up the channels there. And then if you have, like chronic Epstein-Barr or chronic, Lyme disease or whatever, we know that your lymph needs support. And so, this is just a good tool for anybody who's struggling with these things as well.
That's a great point about the dental. Yes, so sinusitis, Marcons, just the postnasal, I see a lot of postnasal. I used to have a lot of postnasal drip with mold. I still had Epstein-Barr flare this winter, and that's when I was using your cream. And I get quite swollen in the neck, and it just feels really good to be doing something for it. I almost feel like you could even pair it with like some hot and cold.
Yeah. We have people typically on our Sophia website, Dr. Klinghardt doing a self-lymphatic drainage massage where he's really kind of getting into the tissues. But I think there's a lot of home tools now, right? So you can just use your own hands, but you can also use like, your red light, or, the little jade rollers, or
I was just thinking that, yeah.
there's these microneedling little home rollers as well to kind of penetrate and enhance as well. So yeah, there's a lot of things to, amplify the effect, but it works fine on its own as well.
Okay. And then I would imagine just we're talking a lot about the head, but just probably any chronic infections like Lyme and just mold toxicity, just in general, it's probably just helping things keep moving.
Absolutely.
Okay.
Absolutely. And
yeah, go ahead.
One of the things I just, want to share is, of course, the cream is such a wonderful tool. And we primarily have people put it on their neck and they can, apply it to other places. But I think one overlooked area of lymph stagnation is the abdomen. And when we have people do manual lymphatic drainage massage or work with a practitioner, we often start on the abdomen and have people really work on moving that lymph in the abdomen to get to drain. Because think of like the lymphatic system almost as a hydraulic system. So if you have pooling or stagnation in one area, other places can't drain. So we find if we really get the abdomen, moving the head and the neck and the extremities can drain better. So, I think that's part of why castor oil packs are so great, or the, Mayan abdominal massage, or even, just good lymph people who work on your abdomen. So I just want to share that with people who are listening, if they're struggling with a lot of things, not to, this is one aspect. And then, we want to think of the rest of our body, as well. So all of this has a place to go.
That's a great suggestion. I remember I interviewed Donna Gates and she was saying how much like lymph congestion of the abdomen was like a big deal. And I hadn't really like thought of that or So I actually still, I put like lemon oil on my belly, to just get some movement. I'm big into like doing squats because I can get your groin kind of opened up for lymph. But yeah, castor oil pack, or you could probably put this right on your abdomen, do some
Yeah,
massage.
some of our patients put that on their abdomen as well, for sure.
Yeah, I think you don't as much realize you're getting lymph congestion unless you start thinking about it. But for me, when I was my sickest, I was like, I feel like my groin crease is off. I could just tell, and people would be like, but I could just tell something was different than how it used to be, and I think things were just pooling there.
Yeah, absolutely. And I always also say, like, we think, of lymphatic stagnation, you have to have like all this edema and swelling and you're, really bloated and inflamed. But a lot of, you can still be really thin, but have like, lymphatic congestion, behind certain organs and things like that. So yeah, that can sometimes be misleading.
Really helpful. Well, congratulations. I've used this product a little bit, but I think I should buy some more to just get a better sense of it and for my own health. So I will approve you to check it out. I'm sharing the screen here, but I have the link in the webinar and the Facebook, and we'll have it under the YouTube video, so you can go check it out. Do you usually have people buy like a pack of them?
We usually just, depending on what they're up for, just usually start with one. And just when you open it, keep it in the fridge, because it's a natural product and we don't have any weird preservatives or anything in there. So just it will stay longer and fresher when you keep it in the fridge.
Okay, I definitely did not keep mine.
It's not like a deal breaker, but I always want
Just to prevent
yeah,
nastiness. Yeah. You don't want people like finding it 3 months later, all gross or whatever. Yeah, well, I'm really excited. I hope the product goes well. I just appreciate you doing this innovative work, because it's definitely, it's just not like another, I don't know, like another B vitamin, or like we have to have better tools for these clients. And you're giving me a lot of ideas for the client I saw today who's really sensitive, and maybe just supporting her lymph, supporting things that are more subtle for her is gonna be the stage that she needs now until she's stronger to do more stuff.
Absolutely. The foundations can really, really help. So
Yeah. Well, thanks to everybody who came on. I appreciate it. If you have questions, afterward for Christine, she does have clinics that you can visit. Let's see.
the Sophia site's great. The sophiahi.com is, if you just want to explore what it's like to work with us or our team, that's a great place to start.
sophiahi.com. Okay. Okay. Perfect. All right. Well, let's stay in touch and have a great weekend, Christine, and to everybody out there.
Yeah.
Thanks, everyone.
Bridget, thanks for your time today.
Bye.
Bye.